Well, new this morning, the South Bend chapter of Delta Sigma Theta sorority is hosting a vaping and synthetic drugs town hall. It's your chance to weigh in on the effects on kids and what can be done to curb it. And joining me this morning is Latoria Green, the Director of Community Health and Well-Being with the Tobacco Initiatives for St. Joe County Health Systems. Thank you so much for being here this morning.
Thank you. Thank you for having me.
All right, great. Well, to start us off, can you explain what the goal is here with this town hall and what are you aiming to change?
Definitely. So we're so excited that the South Bend Alumni chapter of Delta Sigma Theta sorority is partnering with Smoke Free St. Joe, which is also part of St. Joseph Health System, to really provide education to our community regarding vaping as well as synthetic drugs. A lot of people may not know of these different products that are in the community and unfortunately are in the hands of our youth. And so we want to provide that awareness and the opportunity for parents and families to be able to ask questions and to be able to find out how can I, either prevent my child, or if my child is already using these products, what are some great resources that are available to them.
And I saw some of the statistics earlier on, but can you just tell our viewers here, what trends are you guys seeing with vaping and drugs among teens and young adults in our community right now?
Unfortunately, we are seeing an increase of these products. So definitely there is that COVID effect with, kids who are having to be at home of utilizing these products. But really, unfortunately, there's, lots of different chemicals and, these synthetic drugs like synthetic marijuana, synthetic opioids that are out there, which unfortunately are very harmful, for any person to use. But when we think about our youth, and especially when we talk about their development, how it really affects them, especially like liquid nicotine and different, chemicals that are out there. We really want to provide that education for our parents to know and to recognize these products because unfortunately our youth are being targeted by the tobacco industry with their products, whether it's their flavoring, the packaging, how it looks, very colorful. Even a lot of the names are very similar to some like, cereal and candies, that are out there. And unfortunately, when you think of even how they're being sold, they're even being sold in some of our, convenience stores or munchie marts, if you will, where they're actually near, kid-friendly products like soda and candy and pop, and chips, things like that.
And Indiana does have some laws already to curb youth vaping, like higher taxes on some of these pods, and they ban flavored products too. But what more do you think needs to be done here?
Well, we have to enforce the rules, right? Unfortunately, we have a number of stores that are actually still selling some of these products, and unfortunately are still selling them to our youth. Yes, you must be 21 to be able to purchase these products, but we know just that the percentages alone with our youth that they are getting into the hands of them. And so just making sure that we have more enforcement, but then also more education. A lot of our youth, they're, distracted by the flavors and not knowing that there's dangers that are behind these products that are out there. And so for us to be able to provide that education to them, and like I said, for our parents to be able to recognize these products is very important for that.
And 1 in 5 kids actually use these products too.
Yes, unfortunately. We're seeing an epidemic, levels with our youth of using these particular products. And so we really want to, like I said, make sure that we're educating them about it so that, as we say, don't fall for the flavors, and to really educate themselves about it and know the dangers of it, and to be able to speak up if they are seeing, these different activities, which unfortunately are happening in our schools, whether it's in the back of the classroom or in the bathrooms. We're definitely seeing this behavior going on in our schools. And how can we support our schools as well, too? With what they're going through.